In a new op-ed, Dr. Omer Awan writes that as a fan, he's excited for the World Cup, but as a doctor, he's worried about whether the U.S. is ready for the public health risks that come with millions of visitors. Dr. Awan joins us now, physician and senior public health contributor for Forbes. Welcome to you. We're all excited about some soccer, but we don't want Ebola. So tell me about your concern and why you think the U.S. is ill-equipped right now for this.
Well, I would say, Marni, to start, I don't believe that there will be any major outbreaks at the World Cup. So I think and I believe Americans will overwhelmingly be safe. But with that said, if there was theoretically some sort of big outbreak, I really believe that we are unprepared to fight that. And the reason for that is that we have a fragmented public health system. You know, the basic foundations of great pillars of public health are a strong public health infrastructure, communication, and trust. And those have been eroded, unfortunately, in this post-COVID-19 era of public health. If we take a look at the public health infrastructure, we have gutted our surveillance systems. We have defunded research for life-saving vaccines in the order of hundreds of millions of dollars. And we have laid off hundreds, if not thousands, of CDC officials that would be critical to fight outbreaks like this or future outbreaks that would occur. If we take a look at trust, many polls have showed that trust is at an all-time low. I mean, less than 50% of Americans really trust what's coming out of federal agencies like the CDC and the FDA. And of course, communication, if we look at what's happened with public health communication that should be very transparent and clear, people like Secretary Kennedy, the head of HSS, have been noticeably silent with many of the outbreaks, like, for example, hantavirus and Ebola. We haven't gotten a lot of good and adequate, effective communication from our health agencies. So these are all very concerning if there were to be some major outbreak going forward at the World Cup.
So there are certainly some gaps. The one thing that, you talk about a virus that is a world away, but also just a plane ride away. When you have folks coming in from a lot of different countries, from a health standpoint, how would you like to see people screened to try to prevent virus spread?
Well, what I would say, Marni, is that I'm pleased to see that there is increased screening and surveillance at airports now. This is something that, the Trump administration has done at various airports. There has been, as you stated, increased surveillance of wastewater, so we'll be able to detect many of the different infectious diseases that could pose a threat. And another important consideration here is that now there is more coordination and collaboration between the World Health Organization, the CDC, and state departments. That's going to be critical to move the needle with respect to public health outbreaks or any particular threats. So I do believe that there is definitely positivity in the way that we're preparing. And this proactive approach is necessary. This is what's going to make the public health and World Cup, much more safe for the millions of visitors that are going to come here.
Some of the cuts that you talk about at the federal level, locally, do you have the same concerns in local and state health departments and resources when it comes to monitoring these types of things and being prepared?
Yes, I do have those concerns because those federal cuts impact state level cuts, and all state health departments have essentially received cuts in their personnel, for example, their ability to have laboratory tests for diagnosis, their surveillance systems. This all has a trickle-down effect to even the state level. Now, with that said, there is positive news, and there has been a lot more collaboration, and I do believe that we are making good steps and positive steps to keep people safe for the World Cup going forward. And I don't believe that, for example, Ebola will not be a threat at the World Cup. People are much more likely to have a respiratory virus like COVID or the flu. They're much more likely to have a heat-related illness. They're much more likely to have a foodborne illness like norovirus, as you had stated, Marni, earlier on. So Ebola certainly is not going to be a threat at the World Cup.
All right. Well, I know you're going to one of the matches, so enjoy it. Stay safe, stay healthy. Appreciate your perspective.
My pleasure. Thanks for having me, Marni.
Thanks, Dr. Awan.